They got money for wars, but can't feed the poor. I suppose it says a lot about my musical taste and politics, to quote Tupac Shakur on food insecurity. But I also wanted to share another quotation from Jacques Diop, who is a former head of FAO, who says, "Hunger is not an issue of charity, it is an issue of justice," which is what we're concerned with in our proceedings today as we examine decoloniality and food insecurity. I'm Natalie Dietrich Jones, a research fellow based at the Sir Arthur Lewis Institute of Social and Economic Studies here at UWMONA. I'm also the chair of the Migration and Development Research Cluster, and the cluster has collaborated with FAO, WFP World Food Program, and Wilfrid Laurier University through the MiFOOD network to organize this special plenary on food insecurity in the Caribbean. So this morning we look forward to fruitful discussion on food insecurity in the Caribbean, a topic of deep significance to the socioeconomic well-being of Caribbean peoples and communities. I'm just gonna do, in terms of the flow of the proceedings, a very brief introduction to the session. I will introduce each speaker before they share their presentation. So we'll have roughly an hour of interventions before we hand over to you to share your own questions in relation to this important topic. So during the height of the COVID-19 pandemic, there was significant job loss, and mobility restrictions heightened vulnerability among the poor, impacting food security across the world. The severity of the pandemic and the concomitant effect on food security was felt across the Caribbean region. The subsequent onset of war in Ukraine and other key food exporting regions has disrupted global food supply chains and escalated the price of food. In addition, weather-related events, droughts and flooding, which are being exacerbated by climate change, have also affected food production. I'm not going to share any statistics because that is part of the purpose of the panel, to provide up-to-date information on the state of food security in the region. But what we'll aim to do this morning is to explore continuities of food insecurity in the post-COVID-19 context among CARICOM member states. We will shed light on the peculiar vulnerabilities facing these small island developing states, as well as the regional and global externalities which exacerbate these challenges. The panel will juxtapose these macroeconomic issues with concerns related to household food insecurity. So it will also comparatively assess the experience of the Caribbean with the African continent, which shares with this region political and economic challenges related to decoloniality. So we have a set of questions which are motivating the panelist discussions. What are the main food insecurity challenges facing the region? To what degree are the challenges driven by internal or external factors? How is food insecurity manifested at the household level? And you'll hear a little bit about that later in panels throughout the day. And what parallels are there between the Caribbean and African experiences of food insecurity? So to start our conversation, we have, as I mentioned, an esteemed panel of practitioners and academics exploring food insecurity in the Caribbean, the wider Americas, and Africa. To start, so I'll just say who they are, and then I will introduce our first panelist, who is Dr. Renata Clarke. So we have Dr. Clarke, who is the sub-regional coordinator at the Food and Agricultural Organization based in Barbados, joining us virtually. Sarah Bailey, Head of Program, World Food Program, also from Barbados, but joining us in person here at Mona, and Professor Jonathan Crush at the Balsillie School of International Affairs, joining us in person as well. So Dr. Clarke is the FAO Sub-Regional Coordinator for the Caribbean, where she leads the strategic visioning of FAO programs and oversees their implementation in the 13 English-speaking countries under her responsibility. The focus of much of FAO's work in the Caribbean is to develop capacities for sustainable, efficient, and market-driven production systems that strengthen the region's resilience and support agri-food sector growth. Prior to taking up her current position in the Caribbean, Dr. Clarke was head of the FAO Food Safety and Quality Unit in Rome, where she led the organization's programs in developing the member states' capacities in all regions to assure the safety of food supplies. She has worked for FAO for 23 years. Dr. Clarke holds a PhD in food science and technology from the Technical University of Nova Scotia and a Bachelor of Science in Chemistry from the University of the West Indies, so another alum of our illustrious institution. So I'll invite Dr. Clarke to share perspectives of the FAO on food insecurity in the Caribbean.
Thank you, Dr. Jones. Thank you for that kind introduction. And thank you as well for those powerful quotes that you started the day, that you started the morning with. So these days, food security features regularly in high-level political discourse within the Caribbean. And there's good reason for that. There's little that is more important to well-being, people's well-being, than food security. And there have been troubling signs. Countries need to stay ahead of the problem and not just react, oftentimes with quick fixes that don't quite achieve target objectives. FAO has food security and raising levels of nutrition and people's well-being through agriculture enshrined in its constitution. The FAO strategic framework, approved by our 194 member countries, is often referred to as the four betters: better production, better nutrition, better environment, better life. The better production puts focus on efficient agriculture supply chains and sustainable agri-food systems in a region that is highly affected by climate change. Better nutrition aims at increasing access to healthy diets. The better environment promotes sustainable use of terrestrial and marine ecosystems. And better life is the ultimate outcome of these improvements of various aspects of the agri-food systems, with an emphasis on inclusiveness and reduced inequalities, leaving no one behind. I have said that there are troubling signs in relation to food security in the Caribbean. Last year's regional review of food security and nutrition for Latin America and the Caribbean provides some statistics. The bottom line is that we are going in the wrong direction with respect to our 2030 targets. For the Caribbean, we have seen increases in both hunger and food insecurity. I will be giving you a fleeting glance at some of these statistics, and of course you can consult the publication more calmly at another time. It is available on the FAO website. First, a look at the prevalence of undernutrition. So levels of undernourishment are relatively low in the English-speaking Caribbean countries. But given our aspiration for zero hunger, any level of undernourishment is a cause for active concern. Additionally, while the prevalence of undernourishment may be low, overall the trend is increasing. We need to understand and to address this trend. Secondly, a quick look at food insecurity. So reported levels of moderate and severe food insecurity in the Caribbean are disturbing. The blue lines on this chart present the average of results collected in each country over the period 2020 to 2022. And we can see that the greatest prevalence is reported within the English-speaking Caribbean is in Jamaica. But we all have a big problem. Between a quarter and a third of populations food insecure, it means that there's a lot that needs to be done. Obesity in children under the age of 5. The prevalence of childhood obesity is increasing in the Caribbean, with Barbados and Trinidad leading the negative trend. While the overall trend is negative, we can see that some countries have managed to reduce this statistic. The numbers out of Belize are particularly striking. The countries of the Caribbean are afflicted by high rates of NCDs at enormous social and economic cost. We all have to find ways to effectively address these. Poor breastfeeding practice, the high cost of healthy diets, negative food environments, all of these are important factors that are driving the trend for childhood obesity. The affordability of a healthy diet. Do people have economic access to healthy diets? This is one of the pillars of food security. If large proportions of the population cannot afford a healthy diet, then clearly policies and programs need to be developed to provide short-term and long-term solutions. And when we look at the consumer price index and how it's been evolving in the Caribbean, we can say that a main driver of unaffordability of a healthy diet is high food prices. And this has partly to do with what's happening around us. We heard this in the introduction, but it also has to do with what we are doing or not doing right here in the region. The logistics of maritime transport, the tariffs on food imports, inadequate investment in modernizing agriculture, all contribute to the observed high prices. I have said, seems that I've done something. Okay, sorry. Addressing food security and nutrition is at the core of FAO's mandate, as I've outlined already. At the 38th session of the FAO Regional Conference for Latin America and the Caribbean that was held in March this year, the member countries emphasized the priority areas where they want FAO to be supporting them. And some of them that are most relevant to the topic of this panel are highlighted here. Firstly, better data for decision-making on food security and social protection. Changes seen in the patterns and prevalence of food insecurity can inform policymakers. A clear understanding of trends in relation to the cost and affordability of healthy diets also informs policy measures. We are working with countries and regional institutions, in particular the OECS Commission and CARICOM, to generate these data and to use them effectively. Another focus for FAO is working with countries to improve efficiency of production systems, building sustainable and financially viable agricultural businesses, because economic diversification through agriculture is a foundation of resilience in the Caribbean. We build capacities within countries to sustainably manage natural resource base, and we promote and facilitate inclusive, market-driven agribusiness opportunities. I'd like to take a look first at the issue of that data to drive sound policy and programs. A few slides ago, we saw the high prevalence of food insecurity in the Caribbean. These data come from the FIES surveys, the Food Insecurity Experience Scale. This is the main indicator of Target 2.1 of the SDGs. Countries implement this simple survey of 8 questions, each of which simply requires a binary response, yes or no. The simplicity of the survey allows governments to integrate it into other statistical instruments so that they can regularly implement the survey. And according to the self-reporting in this survey process, people are categorized as food secure, moderately food insecure, or severely food insecure. If countries do indeed institutionalize the implementation of these surveys, they derive time series that allow them to monitor changes and trends in food insecurity, nationally and subnationally. FAO has done considerable work in the Caribbean over the last 5 to 6 years to build the capacities of countries to implement FIES. The affordability of a healthy diet is a key driver of food insecurity. There is an internationally accepted methodology for determining this. On the screen, this schematic illustrates that methodology. Fundamentally, a healthy diet is first defined and quantified using existing tools like a healthy diet basket or food-based dietary guidelines. Lists of food that are available in each food group are made, and the lowest cost options are then determined. This provides the cost of a healthy diet. Then there's simply a comparison with income levels in the country to give an indication of affordability in each country. The data on costs for applying this methodology comes from the global food price data set maintained by the World Bank. The availability of these data allow us to derive this global picture, from which we have been able to say that the Caribbean is the region with the highest cost of a healthy diet. This tells us that we have a problem, but it doesn't tell us enough to guide us on how best to deal with the situation. The global food price data set does not include all foods. A more accurate picture can be derived if we're using national food lists. And this is what we are going to be doing with countries, to give a more accurate picture that can guide countries on what are the dietary options and what actions could be taken to make key items more affordable. How can social safety net programs be redesigned to better support the objective of food security and healthy diets? As I said, we will be doing this work in a few pilot countries in the Caribbean this year, and we are working closely with CARICOM and the OECS Commission so that we can drive the sharing of lessons and information, but also drive the utilization of these data in decision-making and policy-making. A critical and exciting area of work for us is in supporting countries to develop more efficient production systems. We've been promoting the optimization of greenhouses and other protected structures. We've been working on the issue of water. You know, with climate change, we have increasing droughts in terms of duration and severity. In many countries, you know, production is only for a few months of the year because of the low investment in irrigation and the low availability of water. We are driving efficiency. So it's not only a question of access to water, but it is efficient use of water. So we are working with countries to be improving water use efficiency, but also efficiency in the use of other agricultural inputs. We are introducing elements of precision agriculture. And of course, there's a strong element of capacity development. So we're developing guides, technical information, working with extension services to promote good practices, both in relation to new and old techniques. We've been supporting a lot of work on sustainable management of marine environments, the issue of illegal, unreported, and unregulated fishing, IUU, the management of FADs, floating aggregating devices, the establishment of managed marine areas, marine spatial planning. All of this is work ongoing. We are currently a partner of the PISLM, working in countries to help them meet their land degradation targets under a GEF-funded project called Soil Care. So this project is about, exactly as the title says, improving the condition of soils. And we're developing capacities in country for collecting and using information from drones in land use planning, disaster risk management. A food secure future certainly requires that we be effective custodians of our natural resource base. Additionally, we have considerable focus on inclusive livelihood opportunities. Poverty is obviously a core driver of food insecurity. We're putting a lot of attention on the viability of businesses, not just pushing technical, however ingenious the solutions will be. We need to make sure, and we're spending a lot more time than we had previously on looking at the business case of the innovations or the technologies that we are pushing. We are moving out of our own traditional comfort zone by working increasingly, building linkages with entities that can help us leverage private sector investment or blended finance to facilitate access to financing. And we have a focus on youth and women. Oh, sorry, I forgot to change the slide. Okay. In closing, I would like to underline a few key thoughts. We can never be complacent about food security. It is way too important, and due to its complexity, it is so dependent on numerous factors that we have to always be on alert and understand, of course, food security is not just the availability of sufficient food. It requires the availability at all times for all people. That availability must be physical and economic. And that food must also be safe and nutritious. Achieving that stable condition of food security requires holistic planning and action. High food prices is a major driver for increasing food security. So we need to be very careful in analyzing trade-offs in relation to tariffs, thinking about how we deal with the issue of maritime transport, thinking of how we deal with incentives for efficient and sustainable production systems. Of course, the issue of climate change is an important aggravating factor. We do need to invest in climate change adaptation. Achieving transformation of agriculture and assuring food security will require thinking and acting differently. And it's not just that somebody else needs to do something differently. It's all of us. As consumers, as specialists in the area of agriculture, as anybody working in the government, we do need whole of government responses for driving a food security agenda. We need a progressive private sector. There is an important regional dimension for food security in the Caribbean, and we are all very much aware of the 25 by 25 initiative. It says we must all increase production, but food availability at the regional level is a security and an assurance for us all within the region. And we need concerted partner support because there's a lot that needs to be done. We have to get over each of us thinking we can run along our paths and make a difference. We will only make a difference if we pull together. Those are my reflections on food insecurity in the Caribbean. Thank you.
Thank you, Dr. Clarke. Right on time. Some very grim statistics, unfortunately. Between a quarter and a third of the population in the region is food insecure, and the region has the highest cost of financing a healthy diet. So we're going to transition to Sarah Bailey, who is head of program for the World Food Program Caribbean Multi-Country Office. She'll bring a different perspective, still sharing some statistics from 2023, but additional perspectives in terms of livelihoods and food insecurity and crises or pandemics and food insecurity. So I'll just introduce Sarah. She brings nearly 2 decades of experience in the international humanitarian and development sector, and is an expert in disaster response, food security, and social protection. Prior to joining World Food Program, she worked as an independent consultant and researcher at the Overseas Development Institute in London. Sarah holds a Masters of Arts in Law and Diplomacy from the Fletcher School at Tufts University.
Thank you very much. Good morning. Morning. All right, glad to hear that. And I'm really excited about the presentation that Dr. Clarke just gave. We work extremely closely together, WFP and FAO, and actually a bit of trivia is when WFP was created in the 1960s, we were originally a project of FAO, and now we are sister agencies that together work on issues of food insecurity. So I wanted to start by telling you a bit about who we are at the World Food Program. Globally, we reach nearly 150 million people a year in 120 countries. We're the world's largest humanitarian organization focused in on saving lives in emergencies and also supporting people who are vulnerable to or impacted by conflict, disasters, and the impact of climate change. Here in the Caribbean, we have a multi-country office that covers the English and Dutch-speaking Caribbean. We also have a team that is based here in Jamaica. I'm based in Barbados, led by my colleague Dana Siketti, who is here as well. And we created our office in 2018, basically reestablished our presence in the English-speaking Caribbean on the back of Hurricanes Irma and Maria. Effectively seeing that our expertise as it relates to emergency preparedness, the impacts of climate change, and also social protection and food systems, that we had a role to play. So basically, with small island developing states in the Caribbean so vulnerable to the impacts of hazards, to the impacts of climate change, we just feel that it's important to be here along with sister agencies like FAO, working closely with governments and with regional institutions to be able to have stronger systems related to food systems, related to emergency preparedness, and also related to social protection, which I will be talking a bit more about. So this presentation is going to have 2 themes. The first is already made. Dr. Clarke made it eloquently, as well as the introduction to this panel, which is around why food insecurity matters and food security matters in the Caribbean. And I'll also be looking at certain results from CARICOM and WFP implemented survey that looks at this from a data perspective, complementing the numbers that were already given by Dr. Clarke. And the second point will be about why disasters and social protection need to be part of the conversation. You would have heard Dr. Clarke mention safety nets. I'm going to get into that a little bit more. When COVID-19 was first unfolding, we effectively worked with CARICOM very quickly to launch a survey related to people's access to markets, related to food consumption, and related to their livelihoods. At the time, so this was in April 2020, it was quite obvious that there were impacts that were unfolding and unfolding quickly. And while there was common sense reflections that there were issues that people were having, particularly accessing food, we needed data behind that to be able to get a picture of the story. So what we did is we worked with CARICOM to quickly launch a survey. We launched the survey within, I believe, 10 days of the decision to actually do the survey. It was an online survey. People could choose to access the survey, circulated via social media. Later, we've circulated it via WhatsApp, text messages as well. And we've continued to do an additional 6 rounds of the survey. And it's hard to see the dates here, but effectively, we did those in June 2020, February 2021, a year later, then in August 2022, May 2023, and we've just had the last survey that closed only, I believe, last week, a couple weeks ago. Now, what this does is the survey basically asks a series of questions about people's ability to access markets, what's happening to their income, how their food consumption is. Are they able to basically have difficulties accessing food, getting food on the table? And we've also been asking them a bit about who they are. What's their age? What's their sex? What's their household like? Are they living alone? Do they live with extended family? And also, how do they perceive their income? Do they see their income as being well below average, average, or above average? Now, why are we doing that? That's so that we can have insights about what this data tells us. And looking at a room of academics, you might say, oh, we should ask you the exact income, but we made some choices. And we made choices so that we could get data that we thought would be valuable and practical. And we also know that people are going to be uncomfortable stating things like their actual income. And that becomes even more complicated when you're looking across multiple countries. These small figures here, the one on the left just shows the number of people that have responded over time. Across all 7 rounds, we're about up to 38,000. The middle one is we actually have a dashboard that has all of this data. You can disaggregate it. You can search by country. You can search by data point, and also by sex and other factors. And then on the right is just a screenshot of the report that was issued last year. I'm excited to say we're going to be launching the next one in a couple of weeks, and I'll be happy to coordinate to make sure that the information on the launch gets out. Now, I'm not going to go through all of our recent findings, but I did want to highlight a few of them that I think are important to ground our conversation here today. One question that we asked was about which statement best reflects your food situation over the past 7 days. And I realize this is a bit hard to read, so I'll take you through it. The darker color is saying, I went 1 whole day without eating. Then it's, I skipped meals or ate less than usual. I ate less preferred foods. I had no difficulties eating enough, or I increased my food intake. Now, the numbers that are important to note is that just in March, we found that 29% of respondents said that they skipped meals or ate less than usual. 5% said that they went an entire day without eating in the previous 7 days. And 27% said that they were eating less preferred foods, which on the whole is very concerning. But what's even more concerning is the graph on the right. What that does is the top one is people who describe their income as well below average, and the bottom one goes down all the way to people who describe their income as well above average. So what we see here is that 15% of people describing their income as well below average went a day without eating in the 7 days prior to the survey. And nearly half also skipped meals or ate less than usual. And so this tells the story that we know to be true and that Dr. Clarke just mentioned, which is that poverty is strongly linked to issues of food access and therefore food insecurity. Now, if we're looking at numbers, it's interesting. I won't get into the details, into the weeds, but happy to talk after the presentation. But FEICE is one methodology and a very important one. WFP also uses a methodology that is called CARI. It's a consolidated approach for reporting indicators on food insecurity. We draw from issues such as coping strategies. Are people making compromises? Are they spending savings to be able to access food? Are they reducing their non-food expenditures, such as on health and on education? And also, are they selling assets to be able to meet their food needs? Because all of those effectively compromise food security in the present and in the future. So using those numbers, last year in May 2023, we estimated that 52% of people in the English-speaking Caribbean were food insecure. And our current results that are coming out see some slight improvement, but the levels are still worse than before COVID. So what this tells us is that COVID-19, then followed by the high food price crisis, has effectively reset the baseline of food insecurity at a lower level and an alarming level. So there's no bouncing back There are only moderate improvements from alarming deteriorations. One feature that I think is important when we talk about data is that we often talk about numbers, but it's also about people, their lives, their experiences. We include within the survey an option for people to add a comment, any comment, just something they want to share with us, right? And this last time, a third of people left comments, so that's over 1,000 voices. And over time, this is thousands of voices of people who are describing their lives, their experiences. A strong common theme was related to challenges accessing work, issues of employment, a lot of worries. And what we've done since the very beginning is sentiment analysis. Sentiment analysis is where you can basically take a large volume of, say, comments in this case, and judge how positive or negative those are. So words like struggle are very negative, and words like hope are positive. And then there's neutral ones, right? And what this does is beyond other analysis that can be done qualitatively on the main themes coming up, it just gives you a sense of where people are who are commenting on this, right? And what we see in this last round, that top one, it goes from very negative in dark blue to positive on the right-hand side. So what you see is perhaps the very negative ones have increased ever so slightly from last year and the year before and the year before that. But in general, there's just such that blue bar in the center, that baby blue, is negative comments. And so you see the people who are expressing their emotions and their feelings and their realities, things are very difficult. And I think we're seeing a lot more struggle than we're seeing for hope. Now, a second issue that I want to raise is we asked about people's resilience. We introduced this last year because we realized if we're looking at issues of how shocks affect food security, COVID-19, high food prices, what's going on, we also need to understand how resilient are people against future shocks, because this is what's going to impact them in the future. So this is looking a bit more at the issue of natural hazards, so things like hurricanes and things of that nature. And we used an indicator that's called the Resilience Capacity Score that WFP has developed. And what it does is it has a series of simple statements like my household is fully prepared for any future natural hazard. If affected by a natural hazard, my household can adapt or change its income source, can access, has savings or finance, can rely on information that will be given to us. And as a result, that's used to kind of determine how resilient are people across their absorptive capacity, their transformative capacity, with information. Where are they? And what we found is that actually the bottom one, this is very counterintuitive because the lower the score, the higher the resilience. So I'll just give you a snapshot, which is basically that where things are most concerning is that people don't have the financial capacity to weather the storms that are coming their way, and they don't feel that they would be able to access that for the most part. Where they are faring a bit better is saying that they're getting the right information. They're getting the information that they need, but actually it's the ability to act on it and to absorb on it. And so financial capacity and being able to rely on institutions for support were where the most concerning ones were. On the right-hand side, we translated this into scores. So that darker blue is having a low resilience capacity. The light blue is having basically a medium resilience capacity, and the gray on the right is having higher resilience capacity. And this is again by income from well below average down to well above average. And so here you see that 56% of people who responded to the survey had a low resilience capacity score, who had classified their income as well below average, 42% who classified their income as below average. And really you're only seeing that 3% of those people describing their income of well below average had high resilience capacity. Again, this is telling us what we know to be true, but it's important that we keep in mind who is more resilient and who is not. Now, Dr. Clarke also brought up an important issue that's near and dear to our heart, which is data. Now, these surveys over time, which by the way have a lot of information, I would encourage you if you're interested to go to the dashboard. I can provide the link. It's really good data. But whether we're collecting and reporting on SDG 2 through the FIAIS, or whether there's these annual surveys from CARICOM and WFP, that doesn't give us the real-time information about what is actually occurring now. So this is right here. We call it it's basically a map that uses real-time data that WFP maintains globally. Now, the way this is done is through basically primary data collection on certain food security and access indicators, combined with real-time data about what's happening with prices, what's happening with rain, what's happening with drought, what's happening with conflict shocks and other hazards. And as a result, by calibrating that to the specific needs or the specific context of different countries, you can see the trends that are happening in real time. The idea here is that gives us the information to act on situations as they are unfolding, rather than when the data comes in through surveys and other things later. So we're quite excited to be exploring possibilities for this real-time food security monitoring here in the Caribbean, because a lot of, other than Haiti and Dominican Republic, and also Cuba, there's really not that representation, particularly for the small island developing states. Now, the point I want to end on is this timeline. Now, this is changing gears a bit, but what this is a timeline that spans 20 years, from 2004 on the left to 2024 or 22 on the right. It is a timeline of shocks that have occurred, starting with Hurricane Ivan in Grenada in 2004, global financial crisis, COVID-19, and a few other shocks. What I would like you to pay attention to is where you see there's a higher volume of text that is over COVID-19. What this figure captures is which countries put in place social protection mechanisms or modified their social protection mechanisms or systems when a shock or a disaster had occurred. Now, by social protection, I mean those programs and policies that are in place to support people through the risks and shocks they face throughout their lives. That could be PATH here in Jamaica. That could be those programs that were created after COVID-19, right? But what this showed is how crucial social protection is as a way to support people, and particularly people already living in poverty or facing vulnerability when shocks occur. And this is why it is so incredibly important that we look at investing in those mechanisms and social protection systems, but about how they can flex. Because even though every single country in the Caribbean turned to social protection during COVID-19, there is no guidance on how you basically start modifying social protection systems when shocks occur. How do you rapidly register people? How do you expand your payment systems? How do you basically become the types of programs that you need to become at a larger scale when a lot of people are in need? And that's something that we are working on with multiple governments to be able to pilot different types of digital payment mechanisms, which we did here in Jamaica, to be able to strengthen information management and digital data collection, which we've done in multiple countries, including here in Jamaica as well. And basically to have that set up to be able to respond, because one of the issues that was so highlighted in the previous presentation is that a lot of this is not just about the availability of food, it's about the ability to access it. And people are purchasing food, and if their income goes down, we know exactly what's going to happen. So I want to end with this point. It's not the only solution, but it's one that we need to keep in mind and make sure that is part of our discussion on preparing for what will happen in the future, alongside all those important investments that were mentioned by Dr. Clarke in her previous presentation. Thank you so much.
So thanks to Sarah. Again, some very sobering statistics. The timeline was a little bit scary to look at in terms of the series of shocks that we've experienced since 2000. It's almost as if we don't have space to breathe. As someone new to the field of food insecurity, to hear about all of those methodologies was particularly interesting for me, and I guess we'll talk afterwards about that resilience capacity indicator. But 52%, based on their calculation, 52% of the population is food insecure. So I'm gonna shift gears a bit. Jonathan is gonna take us to Africa. So Jonathan is a friend of UE, thanks to Professor Thomas Hope, who is sitting in the audience. And they have been collaborating with the university for quite some time on food security initiatives. Our two most recent projects, which Jonathan will speak to, are the MiFOOD and now to start the Women Feeding Cities project. So Jonathan is professor at the Balsillie School of International Affairs and a faculty member in the Department of Political Science at Wilfrid Laurier University, and extraordinary professor at the University of the Western Cape, Cape Town, South Africa. He obtained his first degree at Cambridge University, an MA at Wilfrid Laurier University, and a PhD at Queen's University. He has taught at the National University of Lesotho and the University of Alberta, and was a member of the Queen's faculty from 1987 to 2012. In 2008, he was awarded a Queen's Research Chair, and in 2012, he joined the Balsillie School as CG Chair in Global Migration and Development. Jonathan is a frequent commentator on issues of migration, food security, and xenophobia in the Global South, and has consulted for the IOM, ILO, UNDP, UNAIDS, UNESCO, CEDA, CIC, OECD, and various African governments. Over to you, Jonathan.
Yeah, thanks for the introduction, Natalie. And good morning, everyone. It's okay. All right. So I'm taking you across the Atlantic to Africa, and I've entitled my remarks Making Food Visible in African Cities. And you'll see as I go through what I actually mean by this particular title. Okay. So I've divided my remarks into four issues, 4 Ds, if you like. I want to say something, particularly in the light of the 2 previous presentations, and this kind of gratifying, to me anyway, effort by international organizations to produce a kind of evidence base on which to develop policy. But of course, that is a primary activity of the academy and academics. And so I just want to say something about the challenges of developing knowledge networks around food security, particularly in the Global South. I then want to shift gears quickly to talk about what I see as a fundamental disconnection in the SDGs, which in some ways renders food invisible. And then give you some stats on the dynamics of Africa's urban transition. And finally, really do it's not really a deep dive, but a dive into what I would say are certain dysfunctionalities of African urban food systems. So this is very much a focus on the urban and urban food insecurity. And you'll see why I think that's important as I go through these remarks. So quickly, I want to kind of just back up from MiFOOD network, which we see as a kind of child with a parent, and the parent is Hungry Cities Partnership, and then prior to that, the grandparent, where a lot of us started out some years ago in the African Food Security Urban Network. So AFSUN, founded in 2008, with funding from CEDA, and had a focus on Southern African cities, 11 cities in all. And our idea over time was to expand this to the rest of the continent. And that idea was actually stillborn because of the lack of funding to be able to actually expand what we were doing in the southern part of the continent. And AFSUN, I would say at this point, we're kind of closing it down. For lack of interest in what we've been doing. But, you know, we published a lot, 30 major reports, 3 books, et cetera, and tried to raise the visibility of these issues in the African context. In 2014, we tried to upscale by going a little more global with many of the same research objectives and methodologies on a project funded by the IDRC and the Social Sciences and Humanities Research Council of Canada that we call SHIRC. to look at 7 global cities: Cape Town, Maputo, Nairobi, Mexico City, Kingston, Jamaica, Bangalore, and Nanjing. And the Hungry Cities Partnership has really, I think, had this impact of broadening the comparative analysis of food insecurity in urban centers. There's a website there if you're interested, and also with AFSUN, if you'd like to explore this further. But let me go now to talk about the MiFOOD network, because that's what we're really here about, right? So the MiFOOD network is trying to integrate an analysis of global migration, food security, and as part of that, urbanization. It's a recent initiative founded in 2021. It's several funders mentioned there, and now we're working in 12 countries in the global south. And the focus, as I say, is on this nexus between migration and food security. Okay, next one. This is a very ambitious network. There's 22 partner institutions and over 100 researchers. We sort of moved from left to right, from Canada through the African partners, partners in Caribbean, Latin America, partners in Asia and the Gulf, and then also partnering with several international organizations, including the IOM, ILO, and the FAO and IFPRI. Okay, next slide. So these are the countries: Mexico, Jamaica, Ecuador, Namibia, South Africa, Mozambique, Kenya, Ghana, Qatar, India, Singapore, China. It is a huge challenge to actually organize meetings of all partners, particularly with Zoom. Someone has to get up in the middle of the night somewhere across this partnership. Okay, so MiFOOD goals, I thought I would just list these quickly because they really frame what I want to say, but also the panel that we've organized for later on today. So we're trying to bridge the divide between migration and food security in international, regional, national, and even local research and policy agendas. Second, to assess the role of pandemic shocks, climate change, and conflict-related food insecurity in driving migration. To examine the vulnerabilities of migrants to food insecurity in transit and in destination and origin countries. To work with vulnerable migrant populations, especially women and youth, to build resilience to food insecurity. To collaborate with IOs to raise awareness of the intersections between migration and food security and global, national, and local development agendas, and to build the capacity of organizations in the global south to co-produce knowledge about migration and food security interactions with other stakeholders. Okay, so those are the MiFOOD goals. I won't say anything more about MiFOOD, but the panel this afternoon is presenting a lot of the research that's starting to come out of this particular network, with particular reference to this region. We have, can you just back up one? Yeah, 5 work streams: cities, chains, corridors, connections, and controls. And we're just sort of in the process of completing the second of these work streams, looking at migrants' role and strategies in transforming urban food systems. Okay, so let's move on now to what I call the disconnections in the SDGs. Here they are in all their glory. And I want to focus particularly on 2 of these. Number 2, zero hunger, and number 11, sustainable cities and communities. Now, I'm seeing a slide here. I actually had a slide on zero hunger. Let me try and summarize what it's actually about. So zero hunger is the reduction of hunger by 2030. And if you look at the goals, they're all about, in my view, rural production. There's a huge productionist emphasis supporting of small farmers, and that is the way in which we're going to get to zero hunger. Now, if you then turn to number 11, which is sustainable cities and communities, and ask about okay, what does zero hunger mean for cities? It's very hard to find any evidence, because sustainable cities is about providing access to safe, affordable, accessible, sustainable transport systems, access to adequate, safe, and affordable housing and basic services, providing universal access to green and public spaces, and building sustainable and resilient buildings utilizing local materials. So the disconnect here is that SDG 11, Sustainable Cities and Communities, makes food invisible, right? Food is the responsibility of SDG 2, and that is about rural areas, rural production, supporting small farmers. Very little, nothing actually in SDG 11 about food. So just to summarize this disconnection, SDG 2 is focused primarily on increasing food production by small farmers and believes that this is the key to zero hunger. And in my view, this imagines a world without cities. Whereas SDG 11 has nothing to say or to add to our understanding of urban food systems and the challenge of feeding the world's rapidly growing hungry cities. And in my view, it imagines a world of cities where no one eats anything. Okay, let's go to the next one. So I'll move to my third, and now we're trying to engage this more general overview with the dynamics of what I'm calling the African urban transition. So I've got two graphs here. On the left, it's regional, which Africa is one, Asia, Europe, Latin America, and the Caribbean. And it's actually showing the percentage of the population that's living in cities or in urban areas from about 1950 and then projecting forward to 2050. So it's this urbanization century, if you like. And what you see on the left is the two lowest bars are Africa and Asia. And this tremendous increase from less than 20% in 1950 to projected 55 to 60% by the middle of this century. The other graph breaks Africa down into its regions, because you might say, well, probably it's different in different parts of Africa. Yes, these are different regions are starting from a different base, but none of them are going down, right? None of these lines are going down. In every region of the subcontinent, we're seeing this increase in the proportion of the population who are urbanized, living predominantly for most of the time in cities. And in 2035, Africa as a whole will cross this threshold with more than half the population living in cities. If they turn to SDG 11 to find out what to do to feed themselves, I'm sorry, they're not going to get any advice. All right, so the level of urbanization across Africa is now 43%, 472 million people living in cities. By 2035, that'll rise to 810 million, which will be 45%. And the graph is just showing, the map is showing urbanization rates. The lighter and gray colors are pretty highly urbanized already. For example, South Africa is estimated to be about 70% urbanized, Botswana similarly. But even countries that are perhaps more traditionally thought of having larger rural populations are urbanizing at rates of above 4% per annum. Okay, so what I want to say is the title Making Food Visible is a kind of strange title if you go to any African city. You can walk the streets of an African city and food is everywhere, right? It's not something you have to search out. It's very visible. So just to give you some examples here from two cities that I know quite well, Maputo, Mozambique. We have a lot of street vendors. The lady on the left selling vegetables. And then on the right, those three pictures. The first one is selling vegetables that have been imported from South Africa and from neighboring South Africa at a market, outdoor market in Maputo. In that same market, grains being sold in the middle picture, mostly produced in Mozambique, but also imported from elsewhere in the world, and then a fish market, because Maputo is a big port in downtown Maputo. So food is everywhere and very visible in Maputo. It's also extremely visible in another city, which is Windhoek in Namibia. Windhoek has a series of what they call open markets established by the city. There's one on the left here. You can see the fence to the market and the big one, the big picture, and then numerous vendors actually outside the formal market on the streets, selling a whole variety of foods, from eggs through to grains, vegetables, and so on. And then on the three smaller pictures, we've got what are called informal markets, where groups of vendors have got together and are selling, often at transportation routes. The middle picture, we're moving into something quite distinctive about Namibia, which is the large number, and I'll get to this in a moment, of supermarkets in this city. There's a South African chain called ShopRite, has a number of supermarkets, and this kind of ironic juxtaposition of right outside the ShopRite sign and actually the store itself are informal vendors in the shade underneath, selling some of the same products that you actually get in the supermarkets. And then you go inside the supermarket in Windhoek, and this is a typical shelf with large bags of staple grains shown on this particular supermarket shelf. So both of these cities, food is not invisible to the naked eye. Okay, and my question is it visible to researchers, and is it visible to local policymakers and national government departments? Right, so that's where I get into the final remarks I want to make. And what I want to talk about is some dysfunctionalities of African urban food systems, and just draw on some of the research that we've done. So AFSAN did this survey sort of around about 2010 in these different cities in Southern Africa, using not the methodologies that have been described by my colleagues, but using the FANTA project. HFIAS is the basis of this, HFIAS and HFIAP. And what we find here is that overall across these cities, 77% of households in poor neighborhoods, okay, so these are not citywide surveys. We were focused on particular areas, informal settlements, formal settlements, but low income in each of these cities. So it's a snapshot of food insecurity amongst the most food insecure in the cities. You can see there's some variation from city to city, but in the case of both two cities we've just looked at, Maputo, it's over 80%, and Namibia is actually not, Windhoek's not on this because we did the survey later there. It's about 75% so food's everywhere, and yet this is the picture of food insecurity. Now, if we just look quickly at some comparative data from the Hungry Cities Partnership, remember I said we were working in 6 or 7 cities globally, and these are quite interesting comparisons. I've included Kingston, Jamaica at the bottom here, and we find that in this particular survey, so these surveys are citywide. Unlike the APSUN ones, this is a citywide, nationally citywide representative random household surveys. Okay, so comparing, let's say, Maputo and Kingston, very similar proportions. Both port cities. Maputo is certainly a bit bigger. Similar proportions of food secure, 26, 29%. But then if you scoot across to the severely food insecure, again, very similar, right? 38% severely food insecure and 37% severely food insecure. It's common to kind of often combine moderate and severe. And if you do that, then you're up at over 60% in both of these two cities. Just by the by, and I may draw in some colleagues who have familiarity with some of these other cities, Zhejiang from Nanjing and Solomon from Mexico City, very different profile of food insecurity in those large and even larger cities, actually. Okay, second, so there's something going on, right? There's food everywhere, and yet high levels of food insecurity in these cities. But beyond that, the food systems are not, I mean, they're dysfunctional, they're not working, obviously. But there's this kind of notion that it's not just about hunger and, you know, insufficient food, but we have this increasing double burden of malnutrition. And if you use these kind of biometric indicators, levels of child stunting in Africa, these are kind of countrywide, they're not necessarily just urban, child stunting figures. And then pretty consistent numbers, right, across the continent, and alarming numbers. And then compare that with adult obesity, and of course, obesity then is associated with a whole set of non-communicable diseases, hypertension, diabetes, and so on. That is quite variable if you look at these different regions, right? 23% in Northern Africa, 31% in Southern Africa, much less elsewhere. What unites Northern Africa and Southern Africa is high levels of urbanization. Okay, so these are in a way reflecting adult obesity and the double burden of malnutrition, which is accelerating in the urban areas. What's driving this? There's just a couple of pictures here from the streets of Maputo. So on the left, outside a high school in Maputo, this is what vendors, and some of them are actually very young, kids themselves, are selling. All of these ultra-processed junk foods for kids to come out at recess or at the end of school if they're hungry. We talked to one guy who was trying to sell apples, and the kids weren't buying the apples because they could buy more, you know, chips with the money they've been given by their parents. Incidentally, on the way in from the airport here, I actually saw something quite similar outside one of the schools here. There were vendors selling ultra-processed food. And even when you get a situation where a street vendor is selling vegetables, as on the right, the next table or part of their own store is selling junk food. Now, another dysfunctionality, you could say, is this kind of massive increase in food importation in Africa. So this graph charts from 1994 to 2014. I won't belabor the point. I think it's pretty obvious that in terms of billions of US dollars, the amount of food that's being imported into Africa is enormous. So Africa is being more and more integrated into global food supply chains, but also more and more vulnerable to the disruptions, food price increases, and so on that accompany that. There's an interesting photo, I always think. Okay, so she's in a market in Maputo. She's selling chicken. She's got a whisk to keep the flies away. And she's got what looked like and turned out to be frozen chickens on the right. Now, there's a couple of things about this, and I don't blame her for this, but you know, these chickens were half thawed. And I just asked the question, what happens if nobody buys these half chickens? So she said, well, she actually takes them home, refreezes them, and brings them back the next day. But what to me was also interesting about, especially read the labels on these chickens, all products of Brazil, as in Maputo, And after a little bit of investigation, it turned out that these are chickens from Brazil, frozen, going to the Gulf, mainly to Qatar. And then if they're not, consumed in Qatar, presumably after the best buy date or whatever, then they ship down to Mozambique and into the informal markets. Now, I'm getting towards the end, so we go to the next one. The reason I picked on Namibia is in some ways it's quite similar to Jamaica in terms of population size. It's a much bigger country. It does have a coast, fishing industry, and so on. And the capital of Namibia is quite similar in size, actually, to Kingston. And I do believe, I was just reading in the press, that the two cities have a twinning agreement, Kingston and Windhoek, that was signed in 2022. I'd say something more about that later. So what's happening in this particular city and in a lot of African cities is huge. It's a mass market, urbanization, mass market, and the supermarkets are obviously perceiving a huge market opportunity. So what you find in Windhoek in Namibia, and this map shows this distribution of supermarkets. Now, 20 years ago, you probably would have had about 3 dots on this map. Where are these supermarkets coming from? One is an old trading company that was in Namibia. It's been there 100 years and is kind of retooled and of German origin and become a modern supermarket chain. But the other 4 are all South African, right, from neighboring South Africa. South Africa is probably the most supermarketized country in Africa. And after the end of apartheid, through the late 90s and the last 2 decades, these supermarket chains have pushed their way north, firstly into the regional surrounding countries, and then further into East Africa and even into to West Africa. And what we find is in our survey, we compare patronage of supermarkets and informal outlets, including open markets, tuck shops, and street sellers, for a number of key foods. All right, so grains, bread, rice, pasta, meat, vegetables, mahangu, which is pearl millet, offal, and fruit. So I just draw your attention to so if we just go back, the 3rd column, supermarkets. So for all of these, so these are people living in informal settlements. And in most cases, the majority, sometimes over 90%, are sourcing these foods from supermarkets. So what does that mean? Let's go to this one for the informal food sector. The informal food sector is alive and well in most African cities. There are efforts by governments and international organizations, particularly the Washington-based ones, to, quote, formalize, which could be seen as, well, they're not paying taxes and they ought to be. That's my cynical view about formalization. But the majority are survivalists, right? They're there because there's no other opportunity for them. They can't get any capital to start their little businesses. Banks won't loan to them. So they have to get money from savings or family to start. They're usually 1 or 2 person operations, 70 to 75% women, selling in different sorts of ways. Some are mobile, some are in the markets, and some have little, as they call them, tuck shops. They're often converted containers in the low-income settlements. And what we've tried to do, this is I think something innovative methodologically. Okay, I'll just refer you to this quickly. We've tried to say, is there a way of distinguishing between those who are working as survivalists in the informal food sector and those who might be called opportunists. They have other opportunities, but they choose to be working in this particular sector. And so this paper presents a methodology for distinguishing. What does that mean in practice? Well, if you've got a whole bunch of people who are trying to get out of the sector and a whole bunch of people who are trying against all odds to stay in the sector, then what are the kind of support mechanisms that the opportunists actually need by way of business skills and training, capital, ongoing capital, and so on. The point about these businesses also is that all profit doesn't just get reinvested in the business, it gets siphoned off to support the household. Okay, so there is this huge vulnerability, high turnover. And what we've tried to do in another study is develop a way of kind of differentiating vulnerability and the degree of resilience. So we developed this thing called the IPP scale, which is informal pandemic precarity index and scale, which allows us to classify these micro enterprises on a scale between 0 and 30, where 0 is zero precarity and 30 is maximum precarity. And this particular graph from the study that we're working on relates to informal businesses run by migrants in the city of Cape Town. And you can see it's almost like a normal curve, but it shifts towards the right, which is increasing precarity during the COVID and after the COVID pandemic. Okay, and this is my final point, because it kind of builds on this informal food sector. And you have to ask yourself, what is the attitude of those who hold the levers of governance, the city and national level, towards informal food vendors? And you can see pictures on the right. There's sort of rather visible representation in Johannesburg recently, a thing called Operation Clean Sweep. They always have these kind of, these operations have these names, right? Operation Clean Sweep, and what was another one? Operation Hard Knock. That was a more punitive one. But here we have informal vendors in the bottom one being, arrested by the police. And in the top one, the police actually jumping over the fence and helping themselves to the produce in Operation Clean Sweep. The point I want to make is that the informal food sector could be made much more functional. It's dysfunctional because it operates in a very vulnerable set of spaces. And if you then say to city governments in Africa, such as Cape Town, right, a city that cares for the poor, here's its kind of agenda. It's going to increase the number of toilets by 278%. It's going to increase public works to create 37,000 work opportunities. It's going to increase the proportion of people with free services, and it's going to upgrade housing. R1 billion is going to go into upgrading housing. The point is, I don't see anything about food here, right? There's absolutely nothing about food. And our experience working with city governments, a number of city governments in African cities, is that food in cities doesn't have a place. Right? There's this idea that, well, food is the Department of Agriculture's responsibility and food security. And in a city, we don't have a Department of Agriculture. So it's very difficult to actually find a place. In this particular case, we developed a food system policy for Cape Town. And it sat on the mayor's desk and never became public. Never public, and of course, never implemented. and the primary reason is a conflict between what we were saying about the necessity to preserve those areas within the city where there were small farms, and we're supplying a lot of the vegetables to informal vendors. But the developers who had the mayor's heir here wanted all of this land, to put up housing and so forth. So it's a struggle that continues. All right, so that's really all I have to say. If you're interested in the MiFOOD network, of which SALISES is obviously a partner, this is our brand new website, which we've just launched. I like to think it's pretty impressive, actually. It's a pretty impressive website. And it will kind of give a lot more background about the MiFOOD project, but I certainly invite you all to stay and listen to my colleagues this afternoon, in which we will present some of the research findings of the MiFOOD network. Thanks, Natalie.
All right. So we're a little over time, and I'm not sure if we can take 2 rounds, but we will start with 1 round of questions for the panelists. So I see already, all right, so 3 hands on this side. So we'll take the hands on this side first. I saw Professor Aline's hand up first, and then, is that Dr. Goss in the back? Okay. And then Dr. Northover. So we'll go in that order.
Survey of the WFP. Question though is, could we disentangle from the point of view of a response to food insecurity, the impact of inflation, unemployment, and just basic knowledge and information of what are nutritious foods? My own view is that is a critical element which often isn't pursued. And the question of weak consumer protection systems, or the non-existence of consumer protection systems, which were much more robust in the 70s, and they've seemed to have died out. So my question is, are you able to disentangle these different effects in order to properly address the sources of food insecurity? And let me say something with respect to the ILO presentation. I know the ILO has been historically doing great work in the Caribbean and elsewhere, but from the point of view of, I would say, except for Guyana and Belize and Suriname to some extent, agriculture is dying out in the rest of the Caribbean. The point is that the tourism industry has appropriated a lot of the agricultural lands, and we have not been able to produce an efficient agriculture, no matter how excited we are about local foods. It has to be efficient. Means that you have to use technology and you have to get modern techniques. And very often, while there's an appeal in a crisis to agriculture, the point is it goes nowhere. When you sit at a hotel in St. Kitts and you get your breakfast, it's all comes out from a tin in Miami. And when you ask for pineapples, they say, well, the hurricane knocked them down some years ago. So we have a real problem, I'd say, outside of Guyana, Belize. The Guyana situation is uncertain now with the oil industry. So my question is, how you create an efficient agriculture that is competitive in a world in which you can no longer subsidize agriculture on the WTO.
All right, thanks, Professor Eileen. Just to check, that last comment was directed to FAO and not ILO. It's FAO and WFP. Okay, FAO. All right, thanks. So give the opportunity for responses and possibly another round of questions. So if we can contain yes, thanks. So Dr. Gus, you can go ahead.
Thank you. This is a tricky question for presenter. Why would food be discussed when the government's actually in league with the merchants to drive all of us to supermarkets generally? It's a tricky but other question now is for the two previous ladies. This issue of resilience capacity, the role of culture in an agency. My own perspective is that related to governments will not make anything happen in terms of resilience capacity because the government is actually in league this kind of modernization. So I think the one thing we need to do now is to start working with persons in cultural groups, people themselves, helping people to understand, educating them about their backyard farming. Right? So that we have level of diversification rather than being lumped all of us to market and supermarkets as the source of food, and when prices goes up, then we have other problems. So that's my question about agency and culture, the role of culture and agency in informing people, so that people have alternatives rather than we are being forced in a nice way to become more and more urbanized, and then more and more supermarkets will emerge, and that's why they're emerging. So all of us are become part of the matrix. So that the question about agent culture.
Thank you. And then Dr. Northover for this last question for this round.
Hi, greetings everyone. Thank you for putting together this panel, plenary rather. I just wanted to say, where is the visibility on race and gender in the discussion? And I found it particularly striking that FAO could put up slides with such differences between Caribbean countries, with Haiti's high levels of food crisis, and not comment on it in terms of looking at a response, given that Haiti has 10 million people in comparison to CARICOM, which is 15 million. So why are we also invisibilizing fundamental issues of race and gender? And I also wanted to know why it is that the FAO, as an organization, which is a UN-based organization, is not paying attention to the context of the global food system in which CARICOM, the Caribbean has had such a fundamental role in a negative sense. Why? Because we do know that the inequalities that we experience in our global food systems are very much linked to the forms of coloniality and exploitation that took place. And to put things into context would have been very important, because the global food system in all studies have been recognized as being a globally bankrupt system. The global food system contributes to 1/3 of greenhouse gases. The current studies that have been done on the global food system show that they're reaching planetary boundaries, so that they've done an estimate that the cost of the global food system is approximately $13 trillion, whereas the value of the global food system is $10 trillion. That's the difference. The cost-benefit analysis here is that we're losing from the global food system. So if you have systems where you're highly dependent on this global food system, as we've seen in the last presentation, with higher levels of importation, which are driven by what? A system of coloniality, which has made this dependence a part of how you make profits. And so when I think about modernization, I'm really alarmed at the lack of contextualization of what modernization has meant for the Caribbean, and what modernization has meant in terms of hunger statistics, which have been going in the wrong direction for a very long time, and largely for communities which are non-white.
So thanks for those, Dr. Northover. So maybe we can start with Dr. Clarke online, and then Jonathan can take the question about supermarkets and the resilience and agency question for Sarah. So you can go ahead, Dr. Clarke.
Okay, I'll start maybe in the order in which comments were made. The colleague who was speaking about agriculture dying out in most of the Caribbean And this has been true for all of the decades, and I'm quite a few decades old, of my life that I've seen and I've heard, we've all heard discussions about agricultural diversification and improving, reducing food imports. We've been hearing it for decades. What I do find since COVID, I still see it as perhaps the only good thing that COVID did bring to us, was this fear or realization that perhaps we do need to think about food that doesn't come on a ship, because perhaps those supply chains will be broken. It has given a strong push. I hear heads of state discussing agriculture more in the last 2 years than I've heard in the previous 20. So I do believe there is a window of opportunity. It's perhaps a window that will close if we do not perform quickly, but it is hard to suddenly super perform, as several of my colleagues in the ministries across the region tell me. We are being asked to do something that we have not really been built to do for the last several years. So it's a question of countries, ministries, looking at themselves, trying to reorganize, re-strategize, and deliver at the same time. It's a little unrealistic to have, very short time frames. But I'm on the optimist side of this story. I see things happening in agriculture. I see governments investing in agriculture in the last 2 to 3 years more than they have done in the past. So will we win the fight? I've been hearing a lot on the news these days about those great tourism figures. Will we fall back into our sleepy slump and forget that there is a battle to be fought? It depends even on us. Okay, so I'm on the side of we will do it. And maybe we can get together in a couple of years and see who was right. On the issue about the conspiracies of politicians and traders, what can I say? I think countries all over the world, we need much more public engagement in politics. But this is a question that has no end. So I understand the cynicism, but I do think that the politicians in this moment do recognize the need and are really chasing the 25 by 25 targets. So how do we make agriculture much more efficient? Because I do agree, agriculture needs to be more efficient. We talk about modernization, and I think I'm sort of conflating the comments of the last speaker with the previous speaker. Maybe there's a misconception of what is modernization. I've been speaking about modernization of agriculture and investment in a modern agriculture, and there has been none. Agriculture within the Caribbean is very old style and highly unproductive. We are working, and this is an area of major focus, finding those technologies that allow us, with our limited land space and our limited water, to produce as efficiently as possible, to be following, some sort of market logic within the countries. Where is there an opportunity for small farmers, for small agricultural entrepreneurs to make money? What are the constraints that are holding them down? How can we address them? And this is a job that, that we have to believe it can be done, to keep pushing. But there is a lot of change happening throughout the region in relation to agriculture and how it is being envisioned. So I don't share the pessimism. For the lady who thinks that I am, in a very racist way, ignoring Haiti, let me just state the confines of my role. I am the sub-regional coordinator for the English-speaking Caribbean, and it is in this capacity that I'm speaking about agriculture. So I am responsible for the 13 English-speaking countries of the Caribbean. I say English because it includes Suriname, because Dutch is not an official language of the UN. So this is the scope of my responsibility. And certainly, and many of the FAO publications have spoken about the impact of the global crisis on food prices, on food availability. But there are many things I believe that Caribbean countries do need to get a grip on and figure out What are the trade-offs in certain common policies and strategies that are being applied? How do we? There is clearly, well, let me step back. The Caribbean countries, in supporting agriculture, there are a lot of tariffs being placed, and we understand the need to be protecting agriculture, a fledgling agriculture, so that it can stand on its feet and become competitive. But we have to be careful that the protectionism does not create laziness and lethargy, and the people who are benefiting from the high prices are certainly not the vulnerable food insecure. So we are generating data, generating evidence to be driving better awareness of trade-offs, so that we can have policies that focus on what can we do, what is in our power to improve, to reduce inequalities and leave no one behind.
Thank you, Dr. Clarke. So I'm going to hand over to Jonathan. And just to say, we probably won't be able to accommodate a second round of questions based on the time we have now. And there is one small housekeeping matter I want to attend to before we disperse. So bear with us for a couple more minutes to allow the speakers to respond to the questions.
Yeah, thanks for those provocative questions. Let me say something first about supermarkets. And, you know, my experience is African, so not all of this necessarily apply. So in the early part of the century, agricultural economists in the States came up with this idea of the supermarket revolution. It's a bit like reading, you know, the old Rostow's Stages of Growth thing. I was very much influenced by that notion that supermarkets were inevitably going to conquer the world, starting in North America and Europe, spreading into Latin America and stages. It was all stages. There were even stages. And then the final stage was most African countries. This was going to happen. But these agricultural economists had nothing to say about politics and policy. And so they said nothing about the nature of the political context in which this was all supposed to take place. And so that's a major flaw in this kind of argument. But at the same time, it's pretty clear that, to use the expression of the first questioner, that governments are, quote, in league with supermarkets. And so you have to ask yourself, you know, that's actually not a bad characterization, because they, in all sorts of ways, making land available, breaks, tax breaks, et cetera, et cetera. So why are governments in the pockets, or are they in league for reasons that for them make sense? And I suppose you have to understand, at the very least, the challenges that are faced in feeding a low-income population. And when the supermarkets come to the city for fathers and mothers and say, look, up till now, we've just been serving the middle and upper income people in your city with these brand new supermarkets, imported goods. But now we want to make our food and services available to low-income consumers. But is government going to say, no, stay away from the informal settlements? So these supermarkets are developing kind of budget versions of themselves, right? And pushing closer and closer into low-income areas and some right into the low-income areas, or they're all doing it. And the variety of foods that are there for purchase are very limited. And that's why I showed you that one picture, because it's mainly bulk grains. And so strategically, the urban poor go once a month to a supermarket and buy rice or maize meal in bulk, and then are able to make it last for the month. So there is a kind of advantage there from the point of view of the city fathers and mothers. Now, so that's the one point I wanted to make. But the other point I wanted to make is, what is the attitude of these cities? Okay, they're very positive about supermarkets. What is their attitude towards the informal sector? Why do they engage in these persecutions and these attempts to drive informal vendors off the streets, sometimes into formal markets, but there aren't many of them and they're not that big. And it's a kind of combination of, I think, a kind of colonial inheritance of a kind of the so-called modernist city, right? Which has to be kept, has a certain image, and informality in the minds of many is the antithesis of that kind of city. But one has to also realize that the informal food vendors have agency, right? They're not passive victims of this. And in particular, because of this question about gender, I would just emphasize that in many of these cases, the sector is dominated by women vendors who organize, and they organize to contest the attempts of city government to actually get rid of them. But even more than that, they actually utilize supermarkets in their own businesses. And that's why I showed them that picture of those vendors outside a supermarket. So what are they doing? They're buying the food in bulk and then so-called bulk breaking, okay? Breaking it down into smaller, affordable portions for the urban poor. So that's all really I have to say about that. I did have some thoughts about the question of nutrition, but we're over time.
Yes, I'm getting the urgent wrap-up notice, but if you could, in a minute or so, respond to your sets of questions, and then we'll close off.
Yeah, thanks so much. I'll be brief, being in between everyone in the next session. So I wanted to mention two things. A great question about disentangling causes. I think numbers will never be able to give you that insights that we want, but what they can do is disentangle who is being most impacted, right? Who do we need to design these measures for? And we're seeing a few groups based on our survey. So one, of course, that I highlighted very much was people who are lower income. A second one is younger people under 25. We're seeing that those metrics are definitely more concerning. Because the survey was accessible in Spanish, we're also seeing that that's a proxy for Venezuelan migrants and others. That's a group that is experiencing much more severe impacts to these shocks, perhaps because they have the less access to measures to weather them, and their baseline is already in a concerning place. So this disentanglement is so important, both on causes of food insecurity, who is being impacted, and really at the heart of our work at the World Food Program is who is really on the front line, who is most vulnerable, and who is on the edge, and how do we make sure that they are not left out of solutions and they are at the heart of them. And then the final one on culture and resilience, I mean, that's a really great angle. It comes into so many ways, from how Indigenous persons often have their own types of early warning systems. When I was doing work in Congo, and we would ask people about, who do you turn to when something happens? Where do you turn? Where do you turn? It's family and it's the church. Understanding what networks people have access to, but also understanding what it is that they need to be able to complete this picture. And power is often a dynamic. I mean, it's been mentioned a few times here, but access to power structures and where people are, whether that comes from information and other dynamics. So I just want to close by saying thank you so much for having us, and really that as we move forward, you know, addressing food insecurity is a huge challenge. But as Dr. Clarke mentioned, there is a window, and there is a window of opportunity that is unique, and it is so important that we seize this, whether this is CARICOM 25 by 25, whether it's a Small Island Developing States Conference that's happening next month. This is a time for solutions and addressing longstanding challenges.
Okay, thanks so much, and I appreciate, yes, you can give them a round of applause. And thanks to Dr. Clarke for joining us virtually. We appreciate your indulgence. We need to break down the room, but you are invited to the other panels, which are examining food insecurity throughout the day. So there's one right now, and then there's one at 1:30. So I'll see you